Are you worried about losing your vision? You might be surprised to know that your eyelids can steal your vision slowly over time without you realizing it. So do this for me. Take your fingers and pinch your upper eyelid skin. If you can pinch some skin away, you might have something called hooded upper eyelids. But this is the type of surgery that Kenny Rogers or Mickey Rourke or pick any bad celebrity eyelid surgery had, and you're thinking, that is definitely not the outcome I want. But I'm here to tell you that that's wrong. That is not the point of the surgery, and if you go about it in the right way, you'll be able to avoid that kind of outcome. People seem to think that Kenny Rogers had some sort of obsession with cosmetic surgery, but in fact what he had was he took something that was his natural look, which was hooded upper eyelids, and he completely changed it by taking away all the skin. If you follow the steps that I give you here, you'll be able to avoid that outcome and keep your natural appearance with this surgery. I'm gonna give you one tip here. There are surgeons who specialize exclusively in this type of surgery, and they are called oculofacial plastic surgeons or eyelid plastic surgeons. I am one, and if you wanna find one near you, go to oculofacialsociety.org. I can't guarantee that everybody in my field thinks about this the exact same way that I do, but you need to have an expert taking care of you when you have this surgery done if you wanna avoid that kind of outcome that you're worried about in your head. You can even have this surgery without others necessarily noticing anything is different, and it can still improve your vision. The surprising thing is that the surgery can even be covered by insurance in some cases. So this is how upper eyelid surgery is done. The interesting thing is the most important step of the surgery happens before I even pick up a scalpel or a stitch. The most important step of the surgery is when I grab a marker and mark off how much skin I'm gonna remove. The reason is because all of us need to have extra upper eyelid skin on our upper eyelids to help us close our eyes when we blink or when we sleep. Think about it this way. You've got to have extra upper eyelid skin for when you're trying to blink or close your eyes. And even though that sounds obvious, it's not obvious to everybody. The upper eyelid goes down to meet the lower eyelid when it blinks or closes, and so you have to maintain a slack line in the upper eyelid in order to keep a safety margin with the surgery. Another way of saying it is this. Before surgery, what I do is I have people sit up and I have them close their eyes. And I pinch the extra upper eyelid skin, and I pinch and mark, and I stop just short of the point where I actually pull their eyelids open. If you do it that way, you'll keep a safety margin behind where there'll still be enough skin left behind for you to be able to close your eyes eventually after surgery. So if you'd like more information about what exact criteria insurance used to cover this, or other procedures you can have at the same time as this, like lower eyelid surgery, check out some of the other videos on my feed, and I hope that you found this video useful.